So we're streaming now live on YouTube. Good afternoon. I'm Al McFarlane. Welcome to Conversations with Al McFarlane. A special edition. Every Friday, we've been connecting with healthcare professionals from around Twin Cities, around Minnesota, and now around the country, eventually around the world. We want to call attention to the impact of COVID-19, the coronavirus pandemic that affects our communities, humanity worldwide, but particularly impactful on what we call the underserved. In fact, this program is called Serving the Underserved. We're pleased to be in cooperation with the Minnesota leaders of the National Medical Association. And here helping me sort of co-host today's program is Dr. Tomiko Foster. Dr. Foster and her colleague, Dr. Inel Rosario, have been organizing different physicians and healthcare providers, people who are in the spiritual community and in the public service community to have these conversations about how we support, grow resilience, responsiveness in this time of crisis. So Dr. Tomiko Foster, let me welcome you first of all and ask you to introduce the Minnesota group of this conversation, and I'll follow introducing those who are joining us from afar as well.
All right, thank you, Al. I'm excited to be here this afternoon and excited about this panel because I think it'll really represent holistic care from a mind, body, and spirit perspective. First, I would like to introduce Bishop Richard D. Howell Jr. He has been the pastor of Shiloh Temple International Ministry since 1984, alongside his lovely wife, Pastor Betty A. Howell. Bishop Howell holds a bachelor's degree in pastoral studies, a master's of arts degree in counseling psychology, and was awarded an honorary doctorate of divinity. Bishop Howell is the diocesan over the 7th Episcopal District of the Pentecostal Assemblies of the World Incorporated, which is the Minnesota, Wisconsin, Dakotas District Council. He is the author of Possessors of the Kingdom, which was published in 2008, and in 2016, published his most recent work, Faith in Action. He has 2 adult children, 7 grandchildren, and a host of family and friends. Welcome, Bishop. I'd also like to introduce another family church member, Pastor Andre Dukes. He's the assistant pastor at Shiloh Temple International Ministries and the senior director of Collective Impact, Early Childhood for the Northside Achievement Zone, known as NAS. He has worked closely with the community on issues of youth violence, education, and child development, and focuses on the well-being of families and communities. Welcome, Pastor Dukes. And last but certainly not least, I would like to welcome Trina Givens Henry, who's also my sister. She's the founder and clinical director of HRC, Healing and Restoration Consulting, LLC. She has worked as a clinical social worker for 20 years and is a tenured professor with Minneapolis College. HRC provides outpatient therapy, ARMS, which is known as Adult Rehabilitation Mental Health Services, home and community-based individual living skills, and clinical supervision, training, and consultation services. Welcome, Sis Trina Givens Henry.
Thank you, Trina, for joining us. Let me ask Carmen to introduce her cousin, who is joining us by phone and by video from Puerto Rico, Dr. Lourdes Guerrios Rivera. Carmen, go ahead.
Bienvenida. Thank you so much. I have the honor and the pleasure. I'm going to let Mr. Mac do the introductions because he's so beautiful and professional. And I just want to give my prima hermana just un besito, mucho amor, mucho cariño. She is, unmute yourself so that I can also hear you, corazón. Dr. Guerrios is in the front lines of COVID ID with the folks ahí in Puerto Rico. And she recently sent me a picture of her. I'm sure all of you wear the same type of garb. Yeah, and so it was interesting to think that here is America, like Minnesota, Wisconsin, Pennsylvania, but it's an island in the middle of the ocean out there. And so my heart is so full of joy. And I'm very emotional. I'm a llorona, so I'm going to pass it on to Mr. Mack to please introduce.
Let me do that. So Dr. Guerrillos Rivera is a urologist, and she manages benign and malignant medical and surgical disorders of the genitourinary system and the adrenal gland. She's a specialist who has comprehensive knowledge of and skills in endoscopic, percutaneous, and open surgery of congenital and acquired conditions of the urinary and reproductive systems and their contiguous structures. She's married to Ricardo Rodriguez. They have sons, Diego Alejandro Rodriguez and Augusto Rodriguez. And her parents are Carmen's uncle and aunt, Carmen Rivera Guerreros y Roberto Guerrillos. I'm probably butchering your name, Dr. Guerrero.
Y él es cubano, él es cubano, él es cubano.
Mucho gusto en conocerle. Mil gracias para su servicio y bienvenidos a este platform. Thank you for being here. And finally, let me ask my friend and colleague and my young teacher, Femi Akinabe, Dr. Femi Akinabe, who this past week crossed the line and became a MD. He's a physician now, working for years. So yeah, applause. And Femi, let me ask you to introduce our new colleague and friend, Dr. Lakshit Jain, who will be part of this program.
Yes, thank you. So Dr. Lakshit Jain is a psychiatrist in Connecticut, at the State Hospital in Connecticut, working with a number of patients currently suffering from COVID-19. And a big part of the reason why I thought he'd be a great voice to add to this conversation is because he is able to speak to the meeting of mental health and how it affects everything in a person's health and well-being. And we're seeing an explosion of COVID-19. And so he's seeing firsthand on the front lines of what it is to be a healthcare provider dealing with COVID-19 in the context of often communities that are underserved historically.
So Tomiko, let me ask you to begin, Dr. Tomiko Foster, just to set the stage for the conversation. What should our listeners, viewers be thinking about every day as we sort of weigh what our options and choices are in responding to COVID-19?
Yeah, so I think what's going to be nice about this conversation in particular today is something that will help to empower the people on things that they can actually do. I think so much of what has previously been discussed is sort of waiting on institutions and systems to come up with answers and cures and what to do and how to do it, which is needed. But I really want to start driving the focus, like we've talked about in past sessions, of empowerment. And thinking, you know, how can the mind be well if the spirit is not well? And how can the body be well if the mind is not well? So it's all interconnected. It's all holistic. So when we're talking about getting through this and surviving COVID, we may not have all the answers. I want us to survive and arrive on the other side. How do we meld all three entities from a mind, body, and spiritual perspective to bring wholeness and empowerment as we continue to deal with this crisis?
And so let's go to Bishop Howell and Pastor Andre Dukes. From your positions, from your responsibilities as shepherds of community, how are our communities coping? What can we do to cope better? Bishop Howell.
Thank you, Al. Thank you very much. It's very difficult right now, the faith community suffering from new normals that we are not accustomed to. The day that the church shut down was a day that a new normal had begun. And with the social impact of not being able to touch and reach somebody, as you know, many of our African-American churches are very touchy-feely, love to shake hands and hug. And now that's all been taken out of our hands. So the social impact has created a tremendous mental distress that, in my opinion, is not going to go away anytime soon. And that the longer we stay apart from each other, the greater the distress shall be. And I think that there is a certain component of depression now, as well as feeling isolated, and which is also no different from the rest of the community, but certainly is a major concern as we look at the escalation of mental health issues.
Andre, Pastor Dukes.
Absolutely. Let me begin by saying thank you so much for having me. And it's such an honor to be on this esteemed panel. Thank you, Dr. Foster, for the invitation. Let me start by just saying that, social distancing is an oxymoron. People need touch. We need to interact. And so that creates a dynamic within itself that puts families and individuals really in a dire position. So we have at a community level dire circumstances that have only gotten worse. And so what we are seeing is that there's a rise in domestic violence. There is a rise in child abuse. And so families need support. Families need hope. And so, what Bishop Howell just described is really the role that families look to the church to do. And having the inability or actually the limitation of virtual connections with families really doesn't do justice to the need that families have emotionally, spiritually, and in many ways, even when we talk about from a physical standpoint, we, families don't have access to food. They don't have access to, basic needs. And so, the church is in a position now to try to address all of these issues by partnering with community. And so I know that, Shadow Temple is distributing food once a month as much as we can, but also trying to refer families to places that they can go in the community where they can get healthy food, which is going great. But families also need, rental assistance. They need emergency assistance for our lights and those kinds of things. And, really just trying to coordinate all of these things is a challenge for those that are here to serve families. But then you just think about the impact that it is having on the families. And, again, it is just making a dire situation worse.
I'm Al McFarlane. This is a special edition of Conversations with Al McFarlane. We call this session on Friday, Serving the Underserved, and our intent is to bring providers, leaders in the health professions into a forum, a conversation, advising you about how we can approach understanding, awareness, and move towards healing, protecting ourselves during the coronavirus pandemic. Let me ask Dr. Lourdes to jump in here. And as a surgeon and also as a Puerto Rican, a Boricua, this idea of community touching feeling, being able to embrace, that means a lot to the Afro-Latino community as well. Yeah. So describe that impact as you see it in Puerto Rico.
Yeah, basically we are, Puerto Ricans, Hispanics in general, African Americans, we are very expressive. We touch people. We, are very physical in terms of how we expose our feelings. So definitely, this COVID not only has impacted the healthcare system, but also, as you mentioned, Mr. Dukes, the communications, the relationships, as well as Bishop Richard mentioned, the church activities, everything. So I think in terms of as a physician, I think that the way to overcome those limitations is obviously doing more tests. So you can you can know who can need to be like secluded in quarantine, who can go and hug another people. The limitation that we have right now here in Puerto Rico and even in the States is the lack of testing. So if you have access to tests, you will know who has a disease, who can be working, who cannot, and obviously can expand that access to the church. I think it's very important to have an holistic approach, as Tamiko mentioned. It's not only, a disease of, respiratory system, and now you have seen reports that every part of the body is impacted by COVID,
Mhm.
but also the soul, the family. So I think it has to be, and even patients in intensive care units, they have a lot of stress. So they go out and their mental health, it has a lot of problems. So I think this is a disease that has shown what are the disparities and how obviously it's an inconvenience on certain groups, but it's really a challenge to others. So I think this type of communications, having representatives from the health system, from the church, from the, every aspect, it will need to see how we can address those challenges. So I think in terms of a physician here in Puerto Rico, that actually we started the distancing and the lockdown earlier than a lot of places, has led us to like slow down the cases, but
Mhm.
also we don't have a lot of tests. So we are like walking in a very frail situation. Our economy was already disrupted due to Hurricane Maria and the earthquake. So now we have this. So definitely this is going to be something that is going to, as you mentioned, Mr. McFarlane, it will last a lot. It will take time, but also those aspects, as you mentioned, the social component, it are very frail and still are going to get worse. So I think it's very difficult times.
So let me ask Dr. Jane to jump in. In Puerto Rico, for example, the hurricane, then the earthquake, and now COVID-19, trauma on top of trauma on top of trauma. In the African American community, trauma has been persistent from slavery to today. It persists, and we've gotten to where we are acculturated, and we don't even think about the damage that we experience all day, every day, because it's embedded in the air. What do we do from the science of the mind to address the trauma that we're experiencing in an exacerbated way right now, but that's part of the continuum of challenge that we face as people of color in the world, actually? What do you think, Dr. Jane?
Yeah, I'm sorry. I accidentally stopped my video. I mean, it's
lean
just
into your microphone more if you can.
Okay.
Thank you.
Is this better now?
That's fine.
Okay. So, yeah, it's like having a pandemic like COVID-19 already going and affecting a population. So one of the very important ways which a lot of people mention is that trauma, when people and specifically a community has gone through such a traumatic experience, they help each other by supporting each other. And that's what the pastor mentioned about church being such an important part of the community, people reaching out to each other, people supporting each other. In fact, group therapy kind of works in a very similar ways. Like people, not everybody finds answer to every single question. Some people find some answers, some people find other answers, and when they get together and talk about common experiences, common shared traumatic experiences, and how they're working towards, they help each other. And now with this virus kind of preventing that from happening, it can play such an important role in preventing recovery from trauma happening. It's terrible, because, and in fact, if we go, if I digress a little bit, overall, throughout history, church and religion has played a significant role in helping people, especially in traumatic experiences. You have church and religion-based charities that have helped everybody out. Puerto Rico has had a lot of traumatic experiences happening back to back. It's kind of like and it also kind of accumulated trauma is one of the things that is just kind of, and when we talk about the other thing is that there is a set of articles that are coming from the medical world, like accumulated trauma can affect our hormone levels, especially so people who have exposure to intergenerational trauma, they can have a higher level of steroids in their body, which can affect their future generation. They can sensitize them to have a higher propensity of having post-traumatic stress disorder. Higher corticosteroid level can actively affect you, make you vulnerable to have diabetes, can make you vulnerable to heart diseases, hypertension. So it's having an actual impact on your medical health. The other aspect is that if you have trauma affecting your normal day-to-day thought process, it can affect you in adhering to your education. It can, because it affects your ability to focus on your education, that can affect your economic status, that can affect your connections with other people. So it can affect you functioning as a human being. It can affect you prevent you from moving up in a socioeconomic ladder, getting more access to better food, better community, better emotional, economic resources. So it's just plays such a big role.
It's huge. Well, that ties it all together. So let me bring Trina Givens Henry in. What's your experience? What's your observation along these lines, the impact of this pandemic in particular, but look at it in the context of all that we experience as a community and in your client base?
Thank you for the opportunity to be a part of such an esteemed panel. And to my sister, Dr. Morgan, thank you for the invitation. It's a pleasure to be here today. From a psychosocial stressor point of view and in the community, many people are struggling with day-to-day basic needs. As the pastors pointed out, the folk resources that people have, their neighbors, their church, their friends, are normally the people that they initially go to when they're needing services. However, as a provider in the community and a provider of color, many people are trying to connect and figure out how to be proactive during this time and take care of themselves. And because of this, the folk resources are necessary. However, what I'm seeing from a systemic issue, from a systemic lens, is the disparities in the access. Most people, although providers can do telemedicine and video conferencing, most of our population that we serve do not have access to those things. And so the contact is imperative for us to continue to call or try to find means to reach out to the families that we serve. And also from a professional lens, many of the direct care providers are experiencing emotional distress as well and mental distress as well because of the lack of access to equipment, the lack of access to training, and also the isolation of not having adequate contact with others. So in the community, it's just a dire need for us to have that social contact, and it's been a devastating effect on the community. I was just in a meeting with the state recently and advocating for direct workers to have more opportunities for to just reach out to communities through phone if people don't have computers, if they have a phone, because many of our communities, again, do not have that technology. So even though the crisis is happening, the resources are not keeping up with what the needs are in a community. And someone spoke to the issue about the elephant in the room, about the racial disparities. And COVID-19 has just brought the elephant directly into the room, even though it's already been there. Now we're facing it.
Dr. Morgan, we have a challenge here and a choice of focusing on the disparities and bemoaning them certainly acknowledging them, but bemoaning them as we often do. But we also have a choice and a challenge of addressing them and addressing them in earnest. From your position as a physician and as a leader in that community, how do we mobilize the proper voice, encourage proper productive action, encourage a sense of equity and ownership, not only of the problem, but of the solution, and make sure that our voices go into determining what public policy will be and what resources and how resources will be distributed to address the impact, the issues caused by this problem, but other disparity issues as well. What do you think, Dr. Morgan?
Yes, that's an important conversation. And as my sister and others have mentioned, this issue of disparities or inequalities, and it comes not just in health, but that's been my focus, but we have racial wealth gaps too, and in educational gaps and disparities. So all of these lenses in different sectors, we've seen just huge differences in who is able to access care, who the type of care that they receive when they are able to access it, and then also differences in the actual outcome. So who becomes sicker, who lives, who dies. So when a crisis such as COVID shows up, it just further magnifies a problem that we've already known has existed. Mm-hmm. So it is important to continue to have the conversation around how do we bring this to policymakers. How do we have the conversation? As I mentioned before, the data is there. I don't think the data is important. So part of it is continuing to collect data based on race, ethnicity, and language, or what we call real data, to further make the argument, because people like to see numbers. That's just how it works. When it comes to work of equity, I wish it was enough to say we should do the right thing because it's morally right. For most of us, that's enough. But for many, because it's such a capitalistic society, we have to be able to gather the data to say, well, here are the numbers, and this is why it makes sense from a dollar perspective, from an economic perspective, why it makes sense to help equalize and make things equitable, not equal, but equitable. The difference between something being equal and equitable, we've talked about, I just want to say this briefly. If we're talking about 400 plus years of historical trauma that certain population groups have had to deal with, we're already starting at a disadvantage. So we can't expect to give the same amount of resources to them, the same amount of money in a stimulus check, the same type of job opportunities, and expect there to be a catch up. When you're talking about something that's equitable, you need to make up from that difference. You need to make up from that head start that other populations have had. And this has been a conversation that has been going on for years. Like even when we're talking about the conversation of reparations, which a lot of people don't like to talk about, but that's important when you're talking about not equaling, not giving me the same thing that you gave this person, but catching me up or making it equitable to a point where I can actually achieve what I need to achieve in this society. So we continue to have the conversations from a policy standpoint. Certainly it needs to happen in institutions and systems, because in America, that's what dictates who gets what. But I know that we've put a lot of effort into that. We will continue to put effort into that. I'm more interested now into also bringing in the community and engaging in shared decision-making around how do we make that happen? Because a lot of times when these conversations are happening, there's no one that, have our experiences or maybe looks like us or understands that's part of that table and in the room when those conversations are happening. So to answer your question more specifically, I think we need to continue to push for having representation, not just representatives in the room, but representation who can really address the issues that we need, that can speak up on behalf of the community and what the needs are. We need to continue to engage the community in those decisions. It's not enough for us to have a paternalistic viewpoint and to tell others what we think they should have when we don't understand the trauma and what the needs are. So we need to get that information from our community and ask them to be a part of helping to push forth those policies and understanding what's going to best meet their needs. So I'll stop there because I can go on.
That's great. Well, it opens the door for me to ask a question too. I think the youngest person on the call is Dr. Femi Akinagbe. And so, Dr. Femi, as you're listening to this, I want you to talk about your sense of encouraging people to adopt personal consciousness, personal awareness, personal discipline, things you can do to train yourself, your mind, your body, your spirit, so that you become an effective, peace-driven, peace-focused human being on the one hand, but then how do you also ensure, as Dr. Tomiko was suggesting, that we exercise our civic responsibility as well? There is the criticism that younger people are not as inclined to be civically or politically active. May not be true, because we did have the entire Bernie movement. We had the huge movement with Hillary and with Barack, but that comes up from time to time. And there's this question of intergenerational, young people thinking that older people are not as connected with how the future should be, or that they've had their chance already, and feeling that their ideas are being rebuffed or pushed back against by older people that represent a certain status or power. So I'm kind of rambling, but with a purpose. The purpose is to have you reflect on the challenge at hand. How do we promote health awareness, best practices for individuals, and in a way that reflects the society's responsibility to grow knowledge, capability, and effective systems for delivering and maintaining health for everybody in the society? Big question, Dr. Finney.
Yeah, big question, and I don't know the answer. But what I do know is that many of the points that you touch on and many of the things that have been spoken to previously really come back to building capacity and building resilience. I think that, individually building capacity helps to build capacity as a community. Healthy individuals make healthy communities. And there have been many things historically that have kept us from being healthy. There are many things right now that are keeping us from accessing the fullness of our health. But Dr. Morgan spoke to it earlier in that even though we have these challenges, it does not mean that we acquiesce, throw our hands up and say there's nothing we can do. I think that having the mind of acknowledging what's going on, and even in these conversations, having these conversations from a perspective of really like acknowledging our experience and having catharsis through our conversation. Like sometimes I notice it even myself, like when I'm having conversations about the struggle, am I having the conversation from a perspective of commiserating, or am I having the conversation from a perspective of catharsis? And commiserating is just chewing the cud, like going in circles about all the problems that are going wrong without an eye on solution or empowerment or moving forward as a people. Mm-hmm. Catharsis is coming to that same, discussing the same issues, but with the heart to move forward. And I think that when we have these conversations from a place of catharsis, as you and the whole radio station really does promote this way of being, then I think that a couple of things happen. One is that the mind is calmer and more relaxed. And when the mind is calmer and more relaxed, and we're not in this constant fight, freeze mentality, then we're able to access big mind thinking, both individually and collectively. The part of the brain that controls fight or flight is reciprocally innervated from the neocortex, the part of the brain that controls higher level functioning and thinking. And when energy and attention is going to one part, then less is going to the other part. So when we're contracted, and we know this intuitively, when we're contracted and afraid individually and as a community, then we can't open our eyes and see all the potential and possibilities that are around. So, it goes back to what you were saying earlier about getting the grounding individually and communally through connections, whatever way we can in our society, and given this current constraints that we have. And from there, solutions become evident in every turn. What policies we need to support, how we're going to support them, and who we need to put in office, and what we can do to move the process forward individually becomes evident at every turn.
Bishop Howell, jump in. What do you think? What particular role will you have, and do religious leaders, civic leaders, business leaders have to bring our communities individually and collectively forward?
Al, we are not in a hurry to lose hope. And I think right now we're trying to rediscover and redefine what hope is amidst this pandemic. Mm-hmm. It's a new thing. It's not an old thing. And even though it's added on to the trauma that we have experienced for many years, or we're using the word 400 years, for the faith leaders is saying, oh no, here comes another situation that we're going to have to deal with. But yet, if we put it all together, I think it's a wonderful time, finally, to really instill a new power of opportunity, a capability that I think will bring capacity in our community and to our country. And also to our world, excuse me, Puerto Rico. I think that all of us are probably back in 101, okay? The foundational stuff that really made us the people that we became. The strength came from crises. The strength came from pandemics. The strength comes from trauma. As marvelous as we are, we have a glorious testimony how many of our people were resilient enough to not allow status quo to destroy our faith and our hope. And we did something about that. We have a new generation of people now who are learners, great scholars, who have to relearn or new for the first time, this understanding of what it means to survive what we are seeing today. I mean, let's face it, folks, this is a powerful, powerful crisis. Everything shut down from government to sports, entertainment, restaurants, my God, and churches. Who has ever seen anything like this? But yet, there is a silver ray of lining hope that we are able now to put into practice. For instance, we're dealing with social bias. We're dealing with emotional impact. I was at a meeting yesterday, for instance, and it was very sad to hear that an African-American woman in St. Cloud, I was named the city, the police were called upon her because she looked like she was loitering. And all she was doing was looking for a ride. But yet she was accused of loitering because of her skin color. The social bias does not go away. It continues even with the pandemic. You would think by now that all of us with the entire population will come together and start working things out. But it's not that. The politics has divided and conquered our races, has divided and conquered our faith, and divided and conquered our own self-hope. And so, but I'm not giving up. We're not in a hurry to lose hope, but we are in a need for right now to really have these conversations that we're doing today, Al.
Yes.
And really inspire, iron sharpens iron, to bring some type of solution for a long-term problem. And I think we can do it today.
Andre, you talked about that in reconfiguring the ability to create partnerships with other agencies in community. Talk about that if you would. What are you doing and what do you want to see more of on that line?
Yeah, so I'll put on my community hat and talk a little bit about the work that we're doing with the Northside Achievement Zone. And just for those that don't know, the Northside Achievement Zone is a collaborative of 33 organizations and schools that are working to ultimately end multi-generational poverty using education and whole family supports as a lever. And so the way that we do our work is in collaboration with, housing organizations, health organizations, as well as career organizations. But, one of the things that we have been doing is weekly we meet to really understand the needs in each of those sectors. So housing, career and finance, and how families are being impacted. And then coordinating our efforts around providing resources. So in the past couple of weeks, we've been able to address that digital divide and provide 250 Chromebooks to families on the north side. In addition to that, recognizing that there's a need for resources, we had a generous donor give some funds that we were able to deliver or distribute $100 gift cards to families. We are working with Washburn Child Guidance Center and the schools to develop something called coping boxes for families that are being delivered to address the wellness and well-being of that household. And those coping boxes have games and fidgets and activities that really help us to stay calm and to address our mental health. And so that's, a critical piece in terms of stabilizing the community throughout this time. But I just want to end by saying I think it's equally important for us to limit the amount of time we spend watching television and the news. We get a lot of negative reporting, and of course we want to be concerned, but we really need to start planning for what this is going to look like. We will not return to a new normal, the old normal. We will have a new normal that we need to begin to plan and prepare for. And so I think what COVID-19 has done is given us an opportunity to take a step back and reflect on ourselves, first of all, but then, think about the steps that we need to be taking for our community as a whole once we come out on the other side. And I think organizations are doing this as well. We recognize that we can't function in the same way. Much of our work is now virtual, which has created an opportunity, because even when we do start to go back to our in face-to-face meetings, we now have more options. We can bring in a virtual option for families that may not be able to make it into the office or attend some of our classes. And so that has created an opportunity, but we have to be thinking about the opportunity and not stay stuck in the challenge.
One of the things that I want to bring up, it's in the news today, and I kind of look to your generation, Andre, as a motivator, you and probably Dr. Foster and Femi Akinagbe, you all, the news right now is about the young man who was a runner in Georgia, doing a daily run apparently, and stopped by a white father and son who in the vigilante mode are saying that they shot and killed this young man because he looked like a person that had been burglarizing. Social media, the technology has allowed us to see what happened, and it's horrific. And now the social media systems are abuzz, at least nationwide, probably worldwide, calling attention again to that which we know has always occurred, but was always presented as an isolated failure of the system. From our side, we were raised understanding that we were always at risk, and that certain movements, certain words, certain places could endanger our well-being, our lives. And this was an example of what we've been warned out of our history. And so on the one hand, you said, let's not watch too much television, right? And be burdened or weighed down, immobilized by the traumatic things going on. But there still is a need to engage. And where do we find and how do we nurture what we used to call, and not in a negative way, but in a positive way, the fighting spirit, the spirit of doing that enables and empowers us to withstand and to be resilient and to move Bishop Howell through the trauma, through the fight, with the clear intent of coming out better and whole on the other end. So I'm just throwing it out. Maybe Lourdes, you could respond first by talking about how you have discovered this capacity in Puerto Rico to, no matter what has happened, we rise the next morning and we believe that better is still ahead. What do you think about that?
I think, as you mentioned, we have been for years, for centuries, being in trauma and adverse situations, but we have developed a resilience. I will share with you an experience that I had with a patient. She was an 84-year-old female just after the Maria hurricane. Mm-hmm. And she lost everything, like everything. She just told me that she didn't have even a cup to make a coffee. But she was telling me that, and she was like very calm, very very peaceful. And I was in the other side of the relationship. I was like struggling. I was like, how this 83-year-old woman, she is dealing with having nothing, and I am lucky enough that I have things around. I think I have a stress, but that's not a stress. So I think when we are exposed to that kind of experiences, we develop a resilience. People, as mentioned, Dr. Jane, the PTSD, everything is intercalated. So I think we need, as Dukes mentioned, to move forward. I think things are going to get worse because, COVID we will stay and get stable, but then the other diseases are going to get up, the mental disease, the other diseases that have not been taken care of because we are afraid of taking, get contagious with COVID. So I think, the upcoming month, years, I don't know, it's going to be worse. The disparities are going to get worse. So we have to be creative. We have to see what other, as you mentioned, the church, the family, community engagement are vital to move ahead this challenge and get away with the next challenge and go on, because they will be always there. And we as minorities are going to be always be challenged with those. So we have just to work with what we have to move forward and obviously take the advantage for those challenges.
Trina, jump in. What are your thoughts in this conversation?
I definitely agree with that. Just in the communities that we serve, many of our members have been through great traumas and continue to go through that, but have great gratitude and compassion. And I think during this time, we have to continue to appreciate the little things that make us laugh, that makes us feel, and continue to reach out to one another. And we have to be very creative in our approach, because this is a new normal. As Pastor Dukes talked about, is that we have to keep the connection with the community, whether that's mailing, whether it's technology, whether it's reaching out to someone that you haven't had. Because in our community, there's still this misnomer that we're starting to acknowledge mental health, but we're not understanding the treatment and implications of treatment for mental health disorders. And so it is a health condition. It's a huge health condition. And when I talk to family members about that perspective, it's a health condition. And as a provider, I not only have to look at the individual or work with that individual, but I also have to extend myself to the systems as well. And also give my clients that opportunity to understand the resources of being at the table, of also contacting their legislator, also getting involved in the community, also sharing and facilitating resources with providers, because our families are and communities are very resourceful. So we definitely need to continue this. And thank you so much for doing this to all the involved parties, because this is a step in the right direction.
Let me go from there. I think, Bishop Howell, that one of the challenges, Andre, is that, as we've all said, the new normal is something that's under development now, it's under construction. And obviously, a lot of people are not going to be going back to the skyscrapers where they worked or to the jobs they had in different places. So what are they going to do? And the question is, does that present opportunity for us to think creatively and to start building, shaping a new future where people who want to work, and I think people want to work, but find ways to value their presence, their minds, their hands in service to other people. Is it possible that we can figure out how to employ millions of people taking care of millions of other people, one-on-one, one-on-two, one-on-five, as opposed to the challenge of classrooms, for example, where you have a teacher overtaxed, overwhelmed, by standing in front of 35 children who are eager to learn, who have needs? What if you had 35 teachers and 35 kids? Something like that. That's far out. But is that something we should be thinking of now as we envision, as we visualize a new normal, a new future? How do we fully both appreciate, value, engage, and pay for the service we can render to each other in a way that's equitable and that acknowledges the gifts we all bring? What do you think, Dr. Morgan Foster? The Foster Morgan? Your video says Tamiko
Everybody
Foster,
knew it's
but I know you got a new last name.
It's Foster. That's fine.
All right,
That's fine. And I'm going to make a comment. I'm going to actually share some of my space. I would like maybe Pastor Dukes to speak more to this, or Bishop Howell. But I just want to make the comment that you made, which is great, in that this is going to be a new normal. How do we all kind of show up in this new space and recognize that we all need each other? I mean, there's no heroes. There's no, I think about a lot, which, because I'm a health professional, of course, I'm grateful for some of the gratitude, but the frontline workers are your pastors, your bishops, your intercessors, your mental health workers, your medical assistants, your delivery drivers. You know, those are kind of the forgotten front line, the caregivers at home. I mean, I think about when we say the front line and making sure people are protected, but it's like most people are actually being treated in the house. So the caregivers and the people, the family members, are really the frontline people in that household who's caring for those sick people, the PCA workers, the home health workers. So we all need each other. And, you know, as the Bible says, we're one body in many parts. So we're going to all have a different role in this. You know, the eye can't do what the feet do. The mouth can't do what the ear do. So I just want to emphasize that, and I'll turn it over to let one of my esteemed colleagues on the panel say a little bit more about what that would look like. So thank you.
Well,
Bishop or Pastor?
This is really a rich conversation. I'm so glad to be having it. Go ahead, Bishop Howell. You jump in there.
Yes, sir. I tell you, I love the question. I think that opportunities are birthed from new normals. Look at where we are now. If we start going back to our history books and what was the old normal then, look how changes came and brought greater opportunities. I do believe that we just, for instance, just speaking from my own personal perspective, how are we going to conduct church with no church going on? And so we decided to use, you know, live medium like Facebook Live, and holy mackerel. I don't know if I want to go back to the old normal. For instance, I've been a bit facetious, but look how we were able to find a new creation from an old order. And I think your question is indelible. I think that there is, and there will be, we're going to see some great changes because of the pandemic that's actually going to bring greater opportunities and capacity than what we were used to. And it takes creativity. It does take a lot of discussion. But I think what is best now that was not best then will become the norm of our future discussions. I certainly agree that faith will have a lot to do with that, as we are all now putting our heads together. How can we be better caregivers in this time that we're in? And I tell you, the great examples that our health professionals are exhibiting to us, that they are on the front lines. We are really behind in the community, but they are in the front lines working with all these wonderful patients. Wow. It's inspiring us now to come up with some better and greater ideas and how we can also serve this community in a greater fashion. Absolutely. I believe that new ideas are going to come from this, and it's because of a crisis.
Let me ask Dr. Jane to jump in, because Dr. Jane, you're working in, I think, a clinical environment with individuals who have obviously mental health, I think disorder is the right word, maybe it's not the right word, but mental health challenges, who also are experiencing the challenge of COVID-19. That's what I read in your information. So that makes it really, really personal. The people that have conditions, you know, that we generally look at as acute problems with mental health, and then impacted as well by COVID-19 and other health challenges. How do we approach sort of holistic care? And is that critical level of intervention something that is a model for how we have to react and act in community society at large? Yeah, there we go.
So right now I am working on an inpatient unit mainly. So I have patients with like mostly psychotic disorder. So they have basically lost contact with reality. A lot of them don't really acknowledge the coronavirus as an existence. So they have refused testing, they refuse vitals. Like we had to like beg, plead, threaten, I mean, not threaten a lot, but we had to work a lot to get them to get the swabs done. Like a couple of my patients, they are running around on the unit with 103 fever, and they are feeling fine. They're refusing medications. So it's been a challenge working with these individuals who have lost contact with reality and are suffering from coronavirus. And while I'm not working out in the community, I have been in contact with some of my friends who are working in the community, and all the therapy sessions are interrupted. Now, when we talk about therapy, so right now we are talking on video, so you can get some idea of my non-verbal communication. You can see my face, you can make eye contact. In fact, like eye contact is such an important task. Like now with virtual therapy, you can get some aspect of that non-verbal communication, but and it's just that much easier to misunderstand somebody. Like recall anytime you had a text conversation with anybody and somebody misunderstood what you texted, and that set off an argument. Now, when you are thinking of that happening in a therapeutic setting, that can have all kinds of different consequences. It can, in fact, even sever a relationship with your therapist. Like, how dare you said that? Like, the therapist can say, I didn't mean that. But in the end, when somebody feels that they are hurt, you can't tell them like, oh, you were not hurt. Like, they felt that way. You can't deny their feelings. So it's a challenge. Working, it has significantly affected us.
You mentioned that some of the people that you work with in the clinical situation are dissociated, right? And some of us in the community are feeling and talking among ourselves that parts of our community, young people having parties, that suggests a certain dissociation, or people in the neighborhood that we're in. Bishop Howell and I are in North Minneapolis, and on the corner of West Broadway, for example, at Lindale, there's a bus shelter where elderly people have been gathered. This is cynical, Bishop Howell, excuse me, with doing communion. That's a nice way of putting it, at the bus stop for years. And dangerously so, because the consequences and the intent is not a specifically good intent. It's an intent to weather today's challenge, to be. And so we are seeing the behaviors in community where people seem to be denying the impact and the presence and the cost, the challenge, risk of COVID-19. So it's an extension of what you've described inside your clinic, I think. Does that make sense to anybody?
It does. Like another thing that I can mention is that, like, if I personally like World War II, so like when the first American soldiers were coming across those concentration camps and finding out these emaciated Jewish people, it boggled their mind. Like, how can a human being do something to another human being? And they didn't do it just to one human being. They did it to 6 million people, and that is one of the things that affects, like, a lot of people. Like I remember President Eisenhower at that time was like, document everything, because there will be people who will deny it. So when you are sometimes when you are experiencing something that is just truly world-ending level pandemic, like right now you have just imagine a bureaucrat hearing this conversation, like, oh, we are going to have 1 million Americans affected, 75,000 Americans dying. it paralyzes, it boggles your mind, and it is so easy in that moment to just like block that out. Like, oh, that's not going to happen. I'm just going to continue with my life. Like I can talk about my personal experience. Like for a while, I was like, okay, coronavirus is happening. It's happening in China. But then there was this explosion of cases in New York. And then there was this explosion of cases in Connecticut. And then we started having cases with coronavirus in our hospital. Now it's in my unit. So I can personally gauge my own level of anxiety and concern kind of raising, like, okay, this is a serious thing. It was much easier for me to dismiss something happening in China or some visuals coming out from China. But now that it is here, I have been able to kind of put myself together. It's a active thing that you need to do, because it's hard for people to kind of immediately believe in something truly tragic and in such an enormous scale that's happening right now.
Listen, we're out of time. This has been a great conversation. I'm going to take a minute and ask each of us to give a parting thought and kind of go around the table here for this important public policy discussion. I'm Al McFarlane. We call the program Conversations with Al McFarlane. This particular edition of it is called Serving the Underserved, and it's created by our friends and colleagues and leaders, members of the National Medical Association. So let me start with you. In fact, I'll end with you, Dr. Foster. Let me start with Lourdes Guerrios. Final thoughts, impressions, maybe about a minute or so.
Oh, my goodness. I only say, first of all, thank you for this opportunity. This has, Akinabi say, it has been cathartic. So I think this type of activities that promotes creativity, that promote discussions, maybe we don't have the solutions right now, but we will, each of one of us will take some information and see what we can make to overcome this challenge. So the only thing I could say, mi casa y su casa. So thank you for the opportunity.
Mil gracias, mil gracias. Trina Givens Henry.
Oh, I just want, thank you for the opportunity. I think that this needs to definitely continue. And I just want to speak to the overall point of this was to be open to healing and open to seeking opportunity when there's chaos.
Carmen Robles. Turn your mic on. Yeah. Good.
¿Cómo están? What a wonderful, wonderful program. Thank you everyone for being here. I hear the same topic that we had in the 60s, that we had in the 80s, that at least my older sister would tell me. No, I'm only kidding. And so, but I feel a new energy now that si se puede. We're going to do this. My tío in Puerto Rico, his famous phrase is, no te apures, mija, todo va a estar bien. Carmen, busca un poquito de comida. So his whole thing is, don't worry, everything's going to be fine, and has my aunt feed everybody. And I think while we can't feed each other one-on-one, we could certainly carry that message. We can certainly embrace that message, keep it alive. And I want to thank Lourdes and Puerto Rico, because Puerto Rico is part of America, and we're just like, whatever. But we had a 95-year-old Puerto Rican abuela come in this week, and the way she dealt with the earthquake was that she cried, she prayed, and then she danced. And so I share that with all of you, and thank you for your hard work. And we've only just begun. And this is the importance of our ethnic media. You're right, don't sit in front of the television, but then you have to get information. So who do you get it from? Someone that's really feeding you, drink the bleach, do this, or do you get it from the experts in the field so that we can deliver it? We can take this information right into it. So thank you very much. This helps us all by continuing this programming in all communities. So
thank you, Carmen. Dr. Femi, go ahead. Dr. Femi Akinabe.
Thank you all so much for the wisdom that's been shared. Just coming back to the point that Bishop Howell made about how we can use our experiences to overcome and to grow. A lesson from the body, a macrophage. It's one of the principal immune cells in the body. What a macrophage does is that when it sees a virus cell or some other microbe coming, it doesn't run from the cell. In fact, it turns to the microbe and it eats the microbe. When it eats the microbe, it breaks it up and digests it into small pieces and neutralizes it. And then it takes those small pieces, those peptides, and extends it on the outside hand of the macrophage. And what it does is that those pieces then serve as a billboard to other cells around, saying that there's an infection going on, we need to prepare, we need to upregulate our healing systems. The teaching is we have issues going on in our society on a microbiological and macro societal level. We have issues going on: depression, underemployment, disease, all of these going. And this is our experience. Instead of running from it, we can turn to it and use that experience, metabolize the moment, use that experience to learn and to grow. From that healing, we can then offer that healing up to for ourselves and for many. And again, nodding to the wisdom of the bishop and all those that have spoken so eloquently in the language of the church, but from our own wounds, we might offer healing to the world around us. And with that, I thank you.
Wow. Okay, that's great. Andre, you first, and then Bishop, and we'll close with Tamiko Foster.
Morgan. I knew you were going to do that to me.
Of course.
Could I follow that?
Of course.
Oh, Pastor Deuce. You got this.
Let me just say this. It has been said that we are fighting an invisible enemy, and the church knows something about that. And so the only way we can overcome an invisible enemy is by faith. And so I think that it is faith that will get us through this circumstance, and it is faith that will keep us going on. That's all I have to say.
That's wonderful. Well said. Thank you, Bishop Howell.
Thank you, Al. I have enjoyed myself on your program. Thank you, Dr. Foster. Boy, I'm inspired already. Our prayers are with the loved ones and families who are suffering with the virus, and we are going to continue to remember them and reach out to them. But let's keep faith and hope alive. Let us not be weary in well-doing. We shall reap if we faint not. And I think that that scripture alone gives us a foundation to know that things will get better. It will get better. The doctor that just gave that eloquent analogy of the human body, I'd like to bring that over to the spiritual antidote and say, look, what he just said is in the natural, that works in the spiritual as well. So God bless you. Thanks again, everyone. Thank you.
Thank you so much. And Dr. Tamiko Foster Morgan, before we do that, Kelvin, we had sent you, Kelvin's our producer behind the scenes here, some photographs. I think an excellent photograph of Dr. Lourdes in her outfit, suited up. And if you have that and are able to present it on here, please do. If you're not, we're learning the technology as we go, and we'll get better week after week after week. But if you can put it on a screen, Kelvin, go ahead and put it up. If you cannot, that's okay. So Tamiko, Dr. Tamiko Foster Morgan, please close us out.
Okay, thank you, Al. But I think enough has been said here. I just want to reiterate kind of the lessons from this panel, that healing is mind. It's what we think about. It's what we choose to allow into our souls through what we see, through what we listen to. So being mindful of that. Healing is body. It's how we take care of our body as the temple of the Holy Spirit, for those of us who go by that doctrine. And I certainly do. And being careful about what we eat and what we allow into our bodies. That's a big thing we haven't talked enough about, is how we can protect and prepare our body to fight against this virus. You know, it's not like we can't do anything. We have the power through what we eat, choosing the right nutrients and nutrient-dense foods to help prepare our body to fight that battle. And so those macrophages that my young doctor talked about can go into action and do what they need to do. And also healing is spirit. So again, how can the mind and body be well if the spirit man is not well? We need to be able to tap into the spirit. And maybe a different conversation is how we look at prayer And it's more than just a spiritual thing, it's actually physiological, because those areas of the brain that we talk about that mental health therapists are helping to activate with the dopamine and stuff to help through the healing, those same areas of the brain are also activated during prayer, and that's been scientific. So I just want to close by saying, continue to heal mind, body, spirit, continue to lean on one another, because we all need each other. We're one body, different parts. We all have a role in getting through this, and we will get through it.
I'm Al McFarlane. This is Conversations with Al McFarlane, today's program. A wonderful program, wonderful discussion. Thank you all for being here. Thank you for listening. You know, if you like this kind of conversation, support it by tuning in, by liking it, and sharing it. Subscribe to our channel on YouTube, but do all you can to expand, to project this conversation. It's important. And we're calling this Serving the Underserved. Special thanks to the members of the National Medical Association for leadership and service. And thanks for our guests here, Puerto Rico, on the East Coast, and around the world. We'll see you next time. Thank you so much. Bye-bye. Thank you, Calvin.
Great show.
It's a very great show. Good information, inspiring.